So these will be all the supplies that you'll need to perform your soaks. First, you've got your medication. The medication is prescribed to you. It is 2 tablets of a medication called ciprofloxacin. You'll take the 2 tablets and you'll put them inside of the bottle just by dropping them in. And then you can close the cap, let it sit for anywhere between 3 and 5 minutes, and then you'll see the tablets are dissolving. Each time you use it, you're going to want to shake it up real well just to make sure that the medication is nice and mixed up. The other things that you'll need to perform the soak, so you'll need 2 pieces of the 2x2 gauze, which is in the pack that's given to you. You'll need a roll of tape, which is given to you by the surgery center after your surgery. And you'll need 1 Q-tip with a wooden end, which is also in your soak pack. In order to perform the soak, what you'll do first is you'll uncap the bottle and pour a little bit of the medication into the cap, just enough to get the gauze wet. You'll take 1 piece of gauze, unravel it like so that it is more rectangular in shape. Take the 2 corners and stretch it tight. You don't need to roll it, you don't need to twist it, you just leave it flat. Okay. Then you're going to take it and soak it in the medication. It doesn't take long to soak, and so you just want to get the whole thing wet. After it is ready, go ahead and take it out, and you can squeeze some of the extra medication out of it. Okay, it doesn't have to be sopping wet, you just want it to be soaked. Okay, and then you'll see it stretched out like this, and this is exactly how you want it to look before you perform the soak. Okay, the rest of the equipment here is for a dressing after you've put the soak inside the nose. This you'll take and you'll fold it into a small triangle and you'll put it under your nose, which I'll show you shortly. And then you'll tape that piece of gauze to your face to secure the dressing, to secure the soak while it's in place. So first you're going to take your soaked gauze and your wooden Q-tip, and you're going to use the wooden end, not the cotton end. And you're going to take the wooden end and you're going to put it right underneath a corner of the piece of gauze, just like that. It should hang on there a little bit. You don't want to wrap it around, and then it'll go in a little bit easier. Okay. So then you're going to go ahead and insert it into one of your nostrils. Take your pick on whichever one and just insert it into one side and then the opposite side. You're going to aim parallel to the floor. Okay. So you're going to go further back in the nose and not up, because if you put it up, you're going to hit your incisions and that can be painful. You're going to insert it into the nose. You want to go back in the nose about 1.5 inches. And once it starts to hurt or get uncomfortable, then you're going to pull it out, and then you insert a little bit more up into the nostril. Okay? And then you're going to go on the other side, same thing, and you're going to hook it right on the edge. Okay? And then you're going to insert it into the nostril about back 1.5 inches. Same thing, you come out, insert in a little bit further, and then you're going to push it right underneath your incision like so. And then you're going to take the dressing that you made, which is that corner piece, or that piece of gauze shaped into a triangle, and then you're going to put it underneath like this, like a little mustache, and tape it up to the face, and then you can go about your day.